Good day, and welcome to the Medicaid Bootcamp with the South Carolina Public Charter School District. My name is Jocelyn Dawson, and I will be your moderator for this webinar presentation. Let's begin by talking about what we plan to accomplish through this presentation. We will learn Medicaid processes from start to finish, ensure staff are clear on Medicaid processes and protocols, conduct quarterly chart reviews, whether that be virtual, face-to-face, or chart pickup, provide staff with sufficient materials to make informed decisions in the reviewing of charts. The South Carolina Public Charter School District strives to meet all goals that are in alignment with the South Carolina Department of Education, the Department of Health and Human Services, which is also known as Medicaid, and the Centers for Medicare and Medicaid Services best practice recommendations. Let's talk about factors that influence Medicaid reimbursement. Your decision to bill for a service, whether that be speech services, occupational, physical therapy, or nursing services. Staffing, ensuring that you have adequate amount of staff to provide the services for students. Billing correctly or incorrectly. Third-party liability, which is insurance such as Aetna, TRICARE, Blue Choice, Blue Shield, just to name a few. Managed care organization involvement, and there are 5 MCOs. There's Absolute Total Care, Blue Choice, First Choice, Well Care, and Molina. And these are for RBHS services, also known as Rehabilitative Behavioral Health Services. There's currently a moratorium in place by the Department of Health and Human Services for behavioral health services. So we're currently not enrolled in the behavioral health services, so we wouldn't be able to be reimbursed for these services. Let's talk about the processes for Medicaid chart reviews. So there are the consents. There are 4 consents. There's a general Medicaid consent. There's a non-IEP nursing. There's IDEA annual notification, also known as Individuals Disabilities Education Act, and the Physician Medication Administration form. This is for students who are receiving medication in the school. There are referrals for students that have multiple disciplines that are being reviewed. Evaluations or reevaluations. Individual education plan, also known as the IEP, or the individual health plan, also known as the IHP. The clinical service notes, progress summary notes. Then we will also take a look at the QA checklist, which is also known as the quality assurance checklist. And then we'll also talk a little bit about storage and retention of records. So we're going to take a look at consents first. So the first consent that we're looking at is Medicaid General Consent Form. As you see, it does have South Carolina Public Charter School District on here, but you can also add your school's name and logo. And we ask that you don't change any of the information that's in the document because it has been vetted by the South Carolina Department of Education as well as the Department of Health and Human Services. We do need to ensure that you fill out the information at the bottom. The parent writes the student's name and date of birth, the Medicaid number, the parent's signature, as well as a date that the parent signed. Then the next form is the IDEA, which is the annual notification, again, for Individuals Disabilities Education Act. Again, if you just get the parents to fill out the student's name, their Medicaid number, and the parent signs and dates. Then there's also the non-IEP nursing service form, where the student's name needs to be on here at the top, and then the student's name at the bottom. The student doesn't necessarily have to sign the form, but it does have to have the student's date of birth, the student's Medicaid number. Again, the parent must sign and date this form as well. Let's talk a little bit about referrals. So referrals can be made by a licensed practitioner of the healing arts, also known as an LPHA. So an OT provider actually has to get a referral from a physician. The physical therapist can get one from another physical therapist, and on the 31st day, it actually has to be written by a physician or the others that are listed in the document. Speech therapists can actually be written by another speech therapist, as long as it's not the therapist that's actually providing the services. So these are the new forms that the State Department of Ed actually gave to us on August the 27th of 2020. So you can actually use this form or create a form that looks similar to this, but it should have the ICD-10 codes on there and the information that is currently listed on this document. We cannot use other county school districts, such as we can't use Greenville County School District. It has to be your school's logo on it, your school's name on it, or the South Carolina Public Charter School District, but we can't accept them from Greenville County, Pickens County, Aiken County, Charleston County. It has to be South Carolina Public Charter School District or have your school's name and logo on it. And so this particular form is an occupational therapy. And then there's also one for physical therapy, and it's also the same, ensure that the therapist that's providing the services prints her name, signs it, adds her title to it, credentials, and also dates it. And then the last of the 3 referral forms is a speech therapy. Again, the same information applies as the other 2. And then this is the 4th, which is a permission of school administration of prescription medication in a school setting. Again, our rules apply. Please make sure that it is not from the county in which you reside in school, but it either has the South Carolina Public Charter School District's logo on it or your school's logo on it. One of the things that I want to stress is to ensure that the parent has signed it, dated it at the bottom, printed their name and a daytime phone number, because they are actually giving you as a provider at the school permission to administer this medication to their child. Let's talk about evaluations. So evaluations must occur prior to the provision of Medicaid services. The evaluation must be completed by an enrolled Medicaid provider, which is at LPHA. And for Medicaid purposes, these have to be done annually in order to participate in the Medicaid program. And again, the LPHA, which is the provider of service, must clearly document on the evaluation or the reevaluation form their name, their signature, the date, their title, and their credentials. Let's talk a little bit about the IEP. So we've gone through the consents, the referrals, the evaluations in this sequential order. And then now that the evaluation has been done, it's been determined that the student needs services. Therefore, we're now creating an IEP, which is also known as the Individual Education Plan. So just to give you a little bit about what Medicaid is looking for, each individual treatment plan should specify the exact service of the beneficiary should be receiving, whether it's individual or group services. If it is found medically necessary for the student to receive both individual and group services, that needs to be written into the IEP. The IEP also must reflect the frequency and the duration of the treatment for each services, whether it's 30 minutes group per week or 15 minutes individual times twice a week, indicating the beneficiary's strengths and weaknesses in the treatment plan or the IEP is recognized as good clinical practice and is strongly recommended. And then the IEP must contain, again, the signature and the title of the therapist and the date that it was signed. Let's talk about the individual health plan, which is for the students that are receiving medication in the school for 14 days or more. So this is the new form that all schools are asked to use in order to write up an individual education plan. And an individual education plan can only be written by a registered nurse. It can't be written by an LPN. The LPN can only carry out the services and must be supervised by a registered nurse. Now we're going to talk about the services. So these are now the services that are actually put in the IEP and how it moves forward. So occupational therapy, we're going to talk a little bit about occupational therapy. So it says that the services are channeled to improve or restore functional abilities for maximum reduction of physical disability and restoration of a beneficiary to his or her best possible functioning level. So these referrals must be written by a physician. The evaluation reports with recommendations should be attached with the diagnostic test and assessment, and it also should be signed by the licensed occupational therapy. So one of the things that they note, it says when billing for co-therapy, the therapist must split the time. For one therapist must bill for the entire therapist, or both therapists may not be able to bill for the entire therapy, which means that if OT and PT are actually doing a co-treatment and they did it for 30 minutes, each can bill for 15 minutes, or one can bill for the 30 minutes and the other one doesn't bill for the services at all. So we're moving on to physical therapy. Again, evaluation and treatment to prevent or alleviate or compensate for movement dysfunction and related functional problems. Again, this referral can only be written by a physician. It can be written by another PT for only 30 days. After 30 days, it is no longer valid. So on that 31st day, you would need to have a prescription from a physician. Again, the evaluation report will recommend with recommendations with attached diagnostic test or assessment, signed and dated and titled by the physical therapist. And again, it's talking about the co-therapy. So if the PT is actually doing services with the speech therapist on this particular time, and they're doing it for an hour, they both can bill 30 minutes apiece, or one can bill 45 minutes, and one can bill 15 minutes, but they can't bill for a whole hour of services for the student. Speech services. Speech services include the diagnostic, screening, preventive, or corrective services provided to individuals with speech language disorders by or under the direction of an SLP, which is also known as a speech language pathologist. Written referral for services must be signed, dated, and titled by a physician, or again, it can be done by another SLP as long as it's not the provider of service. Evaluations and reevaluations with recommendations must be signed, dated, and titled by the SLP. If these things are not done, then they are considered to be invalid reports. So nursing services. Nursing services are for children under the age of 21 who have specialized health services. It could include nursing assessments, some diagnostic, direct care treatments, administration of medication, the treatment as authorized and prescribed by a physician or a dentist, and or other licensed authorized healthcare personnel. Nurse management, health counseling, and emergency care. A registered nurse, as allowed under the state licensure regulations, must perform acts of nursing diagnosis or prescriptions of therapeutic or corrective measures. Again, referrals, which include a written medical order from services, must be signed by the physician if applicable. My favorite saying is for clinical service notes, if it's not documented, it's not done. So Medicaid looks at clinical service notes as a written summary of each treatment session. The purpose of these notes is to record the nature of the child's treatment by capturing the services provided and summarizing the child's participation in treatment. So it's like telling a story from the beginning to the end. So you are the provider of service, providing the service to the student, but someone is coming in, such as myself, to review this documentation. It's like telling me what happened from the beginning to the end of the service. Again, Medicaid is also looking for you to provide pertinent clinical descriptions of the activities that took place during the session, including an indication of the child's response to treatment as related to stated goals listed in the IEP. Reflect the delivery of a specific billable service as identified in the physician or other LPHA's referral in the child's IEP. Document that the services rendered correspond to the billing as a date of service, the type of service rendered, the minutes and the hours and the length of time of service delivery. Be individualized with the patient's level of participation and response. When completing documentations, each entry must be individualized and patient specific or student specific. Each entry must stand on its own and may not include arrows, ditto marks, or same as above. All clinical notes must include a narrative summary. The documentation must justify the number of units that are billed. All entries must be dated and legibly signed with the provider's name or initials and professional title. If there are any errors, we do ask that you draw one line through it, write your initials and the date that it was actually corrected. Progress summary notes. Progress summary notes are very important because they kind of tell in a quarter what has happened. So Medicaid's definition of a progress summary note is a written note outlining the child's progress that must be completed by the provider every 3 months from the start date of treatment or when it was medically necessary. Again, they're looking for the attendance at the therapy session, the progress towards the goals and the objectives, and to establish the need for continued participation in the treatment. Again, progress summary notes must be written by the provider of service, contain their signature as well as their title, as the date written, and must be filed in the child's clinical service notes or records. So quality assurance. Quality assurance is actually done once a year from the State Department of Education, but it's done quarterly at the district level. So when there are chart reviews and audits, my responsibility at the South Carolina Public Charter School District is that I am doing sample chartings. So each individual charter has a contractual obligation. So when your school leader and your board signs the Appendix A, they're in agreement to these chart reviews and any financial obligations. So the South Carolina Public Charter School has a financial obligation to the State Department of Education. So we have a contract, and so they do an audit annually. So these chart reviews are done at the district level, and then we would actually have to pay the State Department of Education back if there are any findings. All best practice recommendations from the State Department of Education are mandates from the South Carolina Public Charter School District. CMS, which is Centers for Medicare and Medicaid Services. We also have an audit from them that's called PERM, which is Payment Error Rate Measurement, and these are all adjudicated claims. So any claims that we have actually gotten money from, we will be reviewed every 3 years, and they can actually be done whether by fax or in mails. And so they're asking for a sample of adjudicated claims. Now, when we have our audit with the State Department of Ed, the South Carolina Public Charter School District actually gets to pick and choose which charts are actually going to be a part of this audit. That doesn't happen with CMS when they come back to do their PERM audit every 3 years. They pick and choose which charts are going to be audited. So therefore, when the district does the sample charting with the schools, the district is requiring the schools to go back and review the rest of your charts to ensure that they are in compliance with what the State Department of Ed is asking for, as well as the South Carolina Department of Health and Human Services, which is also known as Medicaid. Medicaid eligibility. Every chart should have a Medicaid eligibility in those charts. Starting in August, you should have one from August, and you should have another one from the next school at the beginning of the next quarter, which would actually be in January. So there should be 2 Medicaid eligibilities in your charts. So again, these are the items that are going to be looked for in the Medicaid chart review. So again, we're looking at the consents, that general Medicaid, the non-IEP nursing, the IDEA annual notification, which is also known as the Individual Education Plan Act, and then the physician medication form. And these are for students that are receiving medications in the schools 14 days or more, or PRN medications. There should be referrals, all referrals, the evaluation or the reevaluation, the individual education plan or the IHP, the clinical service notes, the progress summary notes, the QA checklist from the South Carolina Department of Education's website, and the Medicaid eligibility sheet. So we do internal self-assessments prior to the Department of Education, South Carolina Department of Education coming to review us. So as of October the 1st of 2020, there was a memo that was sent to the district that said, the Office of Medicaid Services will begin conducting QA reviews soon and would like to remind school districts that you must complete the internal self-assessment via the QA application at least 2 weeks before the QA review. School districts are responsible for reporting accurate accounts on Medicaid students, non-Medicaid students, and district contact information. What this means is that I would reach out to each of the participating schools that are participating in Medicaid, and you would give me the number of students in your school that actually have Medicaid versus the students that don't have Medicaid, and then that district contact information would actually be on the district level. It says if the ISA, which is the internal self-assessment, has not been completed prior to the scheduled visit, the visit will be canceled. If participants have questions concerning the ISA data, contact your assigned education associate. And this is actually a QA checklist for nursing services. So if you look at it in the same sequential order that we were looking at what needs to be in the charts, it's the exact same way on this QA review sheet. So you have your consents, you have your referrals, you have your assessments. It goes into the IEP, and then it talks about your clinical service notes, your progress summary notes. And if you look to the right, in the white section, it says CAP, which is a corrective action plan. If these items are missing from the chart, which means we get a corrective action plan, we have 30 days to get this information back to the State Department of Ed before they make final rulings on our Medicaid program. So again, this is one for nursing. It's the exact same thing. Your consents, your referrals, your assessments, your treatment plans. Again, you see that there are caps, there are majors. If certain things are missing, like 2.2, it's saying that are there copies of the medical orders in the records? If it's missing, then they're actually going to write us a major, which also equates to us having training. Here's another QA review sheet for occupational therapy. Again, we're looking at consents, referrals, evaluations. If these things are missing, there are caps that are in place, as well as majors for trainings that we will have if the manual referral was dated prior to the evaluation, the provision of service. So we want to make sure that we are in compliance and following what the State Department of Education is asking of us. Physical therapy QA review is the same. Again, we're looking at the consents, the referrals, the evaluations, the treatment plans, clinical service note, progress summary notes. Again, there are caps, there are majors, and there are also minors. Minors mean that we're actually they forewarned us about the problems that they saw in our audits. Here we are looking at the speech quality assurance review. Again, consents, referrals, evaluations. So there's a sequential order again that we must follow. If these items are not there, we're looking at caps, majors, and minors. Corrective action plans are described exactly how a specific problematic situation will be changed to better meet the goals of a company such as a district. So again, here are the caps defined. It says the school district would have to do a written follow-up plan, and we only have 30 days to actually correct what's wrong. So once the South Carolina Department of Education lets the district know what was found in the audit, the district will reach out to the schools in order for them to correct what was wrong, and we have 30 days to get that back in. The major, again, is a written follow-up and will have recoupments or make changes immediately. The minor citation is when we have some type of policy or procedural, and she's talking to us about what we've done wrong and how we need to actually correct it. All of these can result in having funds recouped and sent back to Medicaid. How to store records. So, are you aware prior to destroying or purging any educational or healthcare records, you must give 45-day notice to families and give them the option of picking up those records? Does your district have an archival policy for education and health records? If you don't, I ask that you please start implementing one. All records must be maintained in a secure manner, preferably a 3-lock system, which means the file cabinet should be, with the documentation, should be locked. The door in which the file system is actually housed should be locked. And then the third lock is your main entrance. That's your 3-lock system. Also, with this retaining and storage of records, is that you actually have to hold on to the records 5 years from the date of service. The due process file table for contents, and this is just something that you can look at if you haven't set up charts before. You have your inside covered for your IEPs, and you can actually color code them. Your child find information, your back would be your therapies, your front would be your consents, your tab 2 back would be your parent contact, and the inside back would be your records and intake. Be aware if a student's medical records and or intake documentation does not fit in the back cover, a hanging file folder with a continuation of records will be found directly behind the student's red chart. Helpful resources. So you can actually click on these and become more familiar with Medicaid. So you can sign up for Medicaid bulletins. You can also go to the South Carolina Department of Education's Office of Medicaid Services, and you can actually obtain the quality assurance. There's also the South Carolina Web Tool Portal, in which you would have access to go in and verify your students' Medicaid numbers, and then you would be able to print. I also put on here the provider manual so that you can actually go and print off an LEA, which is also the local education provider manual, which dictates what we can and cannot do in a school setting. And if you should have any questions, here is my information. Feel free to email me or call me on my cell, and I will walk you through any of these processes that have been outlined in this webinar. Thank you for your time and your patience, and have a great day.